Cardiovascular sentences for listening practice. We're going to do an echocardiogram of your heart, focusing on the atria and ventricles, to check how well it's pumping. You have some narrowing in your coronary arteries, especially the left anterior descending artery, which can affect blood flow to your heart. We'll listen to your heart valves to make sure they're opening and closing properly between the atria and ventricles. The chest pain you're feeling could be related to reduced blood flow in your right coronary artery. Your carotid arteries located in your neck supply blood to your brain, so we want to make sure they're clear of blockages. We'll check the pulse in your brachial and radial arteries to assess circulation in your arms. This CT scan will help us look at your thoracic aorta and abdominal aorta to rule out any aneurysms. We're monitoring your jugular vein for signs of fluid buildup related to heart function. Because of your kidney function, we'll be checking the flow through your renal arteries and renal veins. I'm going to examine your femoral artery to ensure good circulation in your legs. Cardiovascular sentences for listening practice. We are checking the right atrium to make sure it's pumping blood correctly into the right ventricle. The ultrasound shows that your left ventricle is working harder than usual to pump blood through the aorta. We'll examine your heart valves to see if any of them are not closing properly. You may feel the pulse in your carotid artery as we check the blood flow in your neck. We place the blood pressure cuff around your upper arm to measure the pressure in the brachial artery. If you place your fingers on your wrist, you can feel the pulse from your radial artery. The CT scan shows some narrowing in your thoracic aorta, which we will need to monitor. We'll check the jugular vein for signs of fluid overload or pressure in your heart. The dye will help us see how well blood is flowing through your left coronary artery and the left anterior descending artery. A blockage in the circumflex artery can affect blood supply to the back of your heart.